All right. Hey, everybody, and welcome back for another deep dive. Today, we're going to be talking about the symptoms of prostate cancer. And we've got a really great source. It's an excerpt that really breaks down all the potential signs and symptoms. When we think about this kind of stuff, we want to make sure that we can recognize it early
Absolutely.
and get the help we need. And
that's the key, right?
that's the key. Early detection
It's
is
important.
That's exactly right.
Yeah.
So, one of the things that our source says right off the bat is that prostate cancer in the early stages can be asymptomatic.
Yeah.
Which is scary because,
It can be very sneaky.
it's sneaky.
It really is.
You don't know what's going on.
Studies show that, men who are diagnosed in those early stages have a significantly higher survival rate.
Okay, well, that's good. That's reassuring to hear. So as it progresses, though, there are some signs that start to kind of pop up. And some of them, we're all adults here.
Exactly.
A little awkward to talk about.
Okay.
But, knowledge is power.
And it's interesting because, these symptoms can be related to prostate cancer, but they could also be caused by other things.
Nice.
Completely. So seeing a doctor is really important for getting the proper diagnosis.
Right. You don't want to freak out.
Yeah.
But you want to pay attention.
Exactly.
So let's dive into some of these potential signs, starting with what our source calls urinary symptoms.
Okay.
Frequent urination, especially like middle of the night.
Yes.
Got to go to the bathroom.
That's called nocturia. And it can happen because, the enlarged prostate is pressing on the urethra, making you feel the urge to go more often.
Okay, that makes sense.
Yeah.
Along with that, difficulty starting or stopping the flow, a weak stream.
Kind of like a kink in a garden hose, right?
Right.
The prostate being right next to the urethra can obstruct the flow if it's enlarged.
I see. Okay. And then, of course, pain or burning during urination, or even blood in the urine or semen.
Important not to ignore those symptoms. They could be due to an infection or other issues, but they also warrant a conversation.
Red flag.
Yeah, with your doctor.
Right.
Early detection is so crucial.
Okay. So moving on to the next category here. Sexual symptoms.
Okay.
And, as you might guess, this can be a sensitive topic.
Yeah, you're right. It is. And it can be difficult to talk about, but it's important to remember that erectile dysfunction can have both physical and psychological components, especially when facing a potential health concern like this.
That's a really good point.
It's vital to consider the whole picture, not just the physical symptoms.
Yeah. And then, there's also painful ejaculation.
Exactly.
Another symptom that can be tough to discuss.
And this is where that open communication with your doctor is so important. Don't let embarrassment prevent you from getting the help you need.
Right. Okay. Our source also talks about pain and discomfort, specifically in areas like lower back, hips, and pelvis. And apparently this kind of pain can signal.
It's fascinating, isn't it? The way cancer can manifest in seemingly unrelated areas.
Yeah, that the cancer is spread to the bones.
And the pain isn't always limited to those spots either.
Oh, really? Okay.
It can radiate to the upper thighs and buttocks even.
Oh.
That's why paying attention to any unexplained pain is so important.
Right. So unexplained things. Our source also mentions sudden weight loss.
Right.
Persistent fatigue.
Right.
Swelling in the legs or pelvic area.
And these are tricky because they can indicate a lot of different issues, not just prostate cancer, but they're definitely not something to ignore, especially if you're experiencing other symptoms.
For sure. I know our source also mentioned the PSA test as a key tool for early detection, even before symptoms show up. Can you explain a bit more about what that is?
Of course. A PSA test is a simple blood test that measures the level of prostate-specific antigen, or PSA, in your blood. This antigen is produced by the prostate gland. While elevated PSA levels can sometimes indicate prostate cancer, it's important to remember that other factors like BPH or even inflammation can also cause a rise in PSA levels.
I see. So it's not a definitive diagnosis on its own.
Right. But it's an important piece of the puzzle.
Okay, that makes sense. So it sounds like, the key takeaway here is to be proactive.
Yeah.
Pay attention to our bodies.
Yeah.
Communicate openly with our doctors.
You got it. Knowledge is power. And understanding these potential warning signs can truly empower you to take charge of your health.
That's so true. And, if anyone out there is experiencing these symptoms,
please don't hesitate to seek medical advice.
Don't hesitate. Early detection is everything.
Couldn't agree more.
Well, thank you so much for breaking this down
Yeah.
for us today. We hope this deep dive has been helpful, and we encourage you to share this information with anyone who might benefit from it. Knowledge is power, and when it comes to our health, it's a power we're sharing. All right, everybody, we'll see you next time.